faithfully conveying value, interpreting great books from around the world.
Hi, this is Sally Book Talk. Today, I'll interpret this book called The Bizarre History of Medicine. Hearing this title, you might have guessed that this book is about the bizarre and absurd things people have done to gain health, maintain it, and
Yeah.
prolong life. For example, Victorian gentlemen sat in mercury vapor baths to treat syphilis, and Ottoman Empire nobles ate dirt in large gulps to prevent plague. Another example, to make the body healthier, some people bled themselves, some embraced radiation, and some even ate other people's corpses. This book was co-authored by two authors. One of them is Lydia Kang, a medical doctor and internist with an MD from Columbia University in the US. The other author is Nate Peterson, a historian and columnist who has contributed to newspapers like The Guardian and the San Francisco Chronicle for many years. In this book, the authors have gathered a wealth of historical materials and, with vivid writing and witty, humorous language, recount those seemingly ridiculous, yet thought-provoking stories from Western medical history. David Agus, MD, from the University of Southern California, reviews this book, saying it will shock you and change your view on the health claims promoted by medical products. The book is divided into 5 chapters, each introducing a category of treatments such as chemical element therapy, plant therapy, surgical therapy, etc., covering nearly 40 bizarre therapies. Next, I'll divide the book's content into 2 parts for your explanation. First, what were the incredible drugs in history? Second, what were the absurd therapies in history? Let's start with the first part and see what incredible drugs there were in history. And in history, what drugs did people invent to treat diseases and prolong life? It can be said that everything from chemical elements extracted from minerals to various plants growing from soil and even parts of the human body itself have been used as drugs. Wow. Whoa. Now, let me tell you one by one. First, let's talk about those chemical elements that were once used as drugs. The first is mercury, which is probably one of the chemical elements we encounter most in daily life. Mercury is liquid at room temperature, also called quicksilver, and you can find it in many everyday items like thermometers, blood pressure monitors, thermos bottles, mirrors, etc. Mercury is a toxic metal, but in ancient times it was used as medicine because of its laxative effect. It can be synthesized into a white powdery compound called calomel, which, when taken in small amounts, mercury stimulates the intestines to quickly cause bowel movements. Calomel was originally used to treat intestinal parasites. After taking it, feces became black and sticky, so people thought it was expelling toxins from the body, naturally helping to cure diseases. Little did they know, this was actually a sign of mercury poisoning. Later, the concept that calomel could detoxify was further expanded. People thought that since it could expel intestinal toxins, by extension, other viruses or toxins like flu and syphilis should also be expelled by mercury. For example, in the 15th century, due to poor hygiene and open private lives, syphilis spread widely in Europe. Even celebrities like Van Gogh and Beethoven weren't spared, and mercury was considered a cure for syphilis at the time. And people mixed mercury chloride with fats to make soaps and ointments to apply on the body, or even heated mercury into vapor for patients to sit in steam baths. The result of such therapies was always mercury poisoning. After contracting syphilis, the famous violinist Paganini used mercury-based therapies mentioned earlier and soon lost his teeth, trembled in his limbs, and had testicles swollen like small pumpkins. Fortunately, Paganini didn't suffer long because he died a month after stopping the treatment, showing how terrifying mercury poisoning is. In Boston, although mercury could somewhat alleviate skin infection symptoms caused by syphilis, mercury's own toxicity was even more frightening than syphilis. So when humans discovered more effective drugs, mercury faded from the historical stage. Now, let's talk about another famous chemical element, radium, the one discovered by Madame Curie. Shortly after radium was discovered, scientists found in clinical trials that it had the amazing ability to destroy cancer cells. This was very exciting at the time because humans had fought cancer for centuries and finally found a cancer killer that could treat it, making radium famous, similar to many wonder drugs. Radium's application quickly went beyond science and medicine into people's daily lives. Various advertisements claimed that radium could not only relieve joint and muscle pain, make skin smoother, but even make men more virile. It's in the 1920s, there were various radium-containing products on the market, including drinks, soaps, toothpaste, and even radium hot springs that provided radioactive bathwater. Trendy people flock to radium. For example, an American tycoon named Byers drank 3 bottles of radium drink daily. Since radium was expensive, this was his way of showing off wealth. Now we know radium is highly harmful radioactive material. Its radiation kills cancer cells but also healthy cells. In other words, it's not a precision-guided missile but a terrifying nuclear bomb. Madame Curie, radium's discoverer, died from radiation exposure caused by radium. The aforementioned tycoon Byers died 5 years after drinking radium drinks. Before death, he weighed only 40 kilos, with his brain full of abscesses and skull riddled with radiation holes like a sieve. To prevent soil contamination, he was buried in a lead coffin, and decades later, his grave still emitted detectable radiation. Besides mercury and radium, many other chemical elements were used as medicines. For example, arsenic treated stomach ailments, main component of arsenic trioxide, antimony-induced vomiting, and gold cured alcoholism. After hearing these stories, some might think these artificially purified chemical elements are terrifying. By comparison, pure natural plants and animals in nature should be harmless to humans, right? Not necessarily, as many plants are toxic or harmful too, like poppy, coca leaves, nux vomica, morning glory seeds, and tobacco. Take tobacco, for example. Now, we all know smoking harms health, with over 6 million tobacco-related deaths worldwide annually. Yet tobacco was once highly regarded as medicine. In the 15th century, Columbus's crew discovered tobacco in the New World. They saw locals burning it for disinfection and making patients inhale smoke before surgery to induce unconsciousness. The crew treasured it like gold and brought tobacco back to Europe. Thereafter, tobacco was widely used medicinally. Swallowing ground tobacco leaves stopped diarrhea, while crushed tobacco liquid treated eczema and skin infections. Others claimed that smoking tobacco could greatly relieve headaches and cold symptoms. In fact, in China, tobacco liquid was also used medicinally, mainly applied externally to treat snake venom, insect stings, eczema, tinea capitis, and other skin conditions. In short, tobacco became a panacea, deeply popular, with the British usage being the most bizarre. There's an English slang phrase, blowing smoke up your ass, meaning insincere flattery. Taken literally, it means blowing smoke into your butt. This phrase originated from a popular 18th century resuscitation method.
Back then, along London's Thames, frequent drownings occurred. Artificial respiration with chest compressions was used on victims.
But this procedure wasn't done casually. If drowning involved an upper-class lady, such first aid was considered worse than killing her outright. So doctors avoided artificial respiration unless desperate, opting first for smoke enema resuscitation. After dragging victims ashore, they'd lay them prone and insert a rubber tube into their buttocks. Using fumigators and bellows, smoke was blown into the butt, hoping to restore breathing and warm the body. Later, people realized saving lives required pumping air into lungs, not butts. Thus, smoke enemas vanished. Subsequent research showed tobacco's harms far outweighed benefits, ending its medicinal use. And not just tobacco. Human pharmacopoeias included even more vicious plants. For example, opium from poppies treated coughs and insomnia. Cocaine from coca leaves eased pain. Strychnine from nux vomica served as a potent stimulant. Using these natural extracts risked addiction and death. Beyond plants, Humans didn't spare animals in their medicinal quest. For instance, blister beetles, Spanish fly, were eaten as aphrodisiacs. Others used bazars from cows, horses, or cats to treat food poisoning. Beyond that, cannibalism for healing occurred, and not just among primitive tribes in Africa's Rift Valley or Pacific Islands. In ancient Greece, the cradle of civilization, cannibalism was quite prevalent. Behind this custom was the popular like cures like theory, where a body part was diseased, eating something similar would heal it. For example, ancient Greeks made pills from dead human brains to treat mental illnesses. Danish doctors ground human skulls into powder to treat a king's epilepsy. Many firmly believed drinking from skull cups cured headaches. If it was a celebrity's skull, it might even boost intelligence. From the 17th to 19th centuries, European pharmacies sold human skulls. Moss growing on aged skulls was scraped off and sold at high prices as medicine. In contrast, 16th century Arab cannibalism was more refined. People chosen as medicine ate only honey before death, until even their waste smelled of honey. After death, their bodies were sealed in honey-filled jars, stored for a period. Honey's nutrients and antibacterial properties gave honey-preserved human flesh a reputation for prolonging life. This human honey candy became famous. Even Li Shizhen, a Ming Dynasty Chinese physician, documented it. He included it in his compendium of Materia Medica. Old Master Li wasn't sensationalizing, he too endorsed like cures like. His compendium has a human body chapter listing 37 medicinal human body parts. Beyond these, ancient Romans drank gladiators' blood hoping to gain their strength. Germans extracted human fat to treat rabies and smallpox. 18th century Europeans obsessed over mummy corpse oil for healing, causing mummy shortages. Fakes flooded markets. Unscrupulous vendors dried beggars or plague victims' corpses. They coated them with asphalt and spices to impersonate Egyptian mummies and swindle wealthy patients. Fortunately, medical progress replaced superstition with anatomy, banishing ineffective cannibalistic therapies from civilization. Besides eating plants, animals, and humans for healing, historically people even ate dirt, like during the Renaissance when Europe's most popular medicine was clay. Wow. This clay wasn't ordinary backyard soil. It came from remote Ottoman Empire mountains, formed into stamped tablets. People believed clay cured dysentery, ulcers, fever, kidney disease, and eye inflammation. Legends claimed near proximity granted healing magic. But as many patients wore clay tablets as neck amulets. Of course, clay proved useless and ended up in museums. If you see someone eating dirt today, they likely have pica from micronutrient deficiency and need urgent hospital care. Okay, that concludes part 1. History's unbelievable miracle drugs. For health and longevity, humans exploited everything. Chemical elements, plants, animals, even fellow humans, deeming anything therapeutic as potential medicine. History showed these medicines were either placebos or actively harmful. Now, with scientific progress, we rarely encounter such bizarre drugs in hospitals now. But if they resurface in supplements or elsewhere, stay vigilant and see through their disguises. Beyond drugs, medical history featured many absurd therapies. Here I'll introduce the most notorious: bloodletting, enemas, electroshock, and electromagnetic therapy.
Let's start with bloodletting, once Western medicine's most renowned treatment.
Records exist from ancient Egypt 3,500 years ago, and it persisted until the 1850s. Bloodletting's theoretical basis originated with ancient Greece's great physician Hippocrates' four humors theory. He believed the body comprised blood, phlegm, yellow bile, and black bile. Disease arose from humoral imbalance. Excess blood caused hot, moist illnesses with redness, swelling, rapid pulse, requiring bloodletting to reduce volume. This is the origin of bloodletting therapy. Initially, the tools for bloodletting were incredibly diverse. Shells, animal teeth, sharpened wood, and live leeches were all used for bloodletting. Later, a curved, sharp blade became predominant, resembling a willow leaf. It was called a lancet. This name persists today as an alternative term for surgical scalpels. Lancets originated from barbers' razors. as Roman barbers not only cut hair and shaved beards but also performed tooth extractions and bloodletting. Their sharp little knives became the most convenient tools. Today, many barbershops still display rotating poles with blue, red, and white stripes, said to be ancient bloodletting symbols. Blue symbolizes veins, red represents blood, and white signifies post-bloodletting bandages. After the 17th century, everyone from kings to commoners used this treatment when ill. Bloodletting caused physical weakness and compensatory reactions.
Compensatory reactions are the body's active defensive against oxygen reduction during heart failure.
These reactions made patients less pain-sensitive and too weak to moan, appearing as effective treatment to observers. Thus, bloodletting treated all ailments: colds, smallpox, even mental illness. Early and copious bloodletting became standard. Bloodletting's popularity brought high mortality rates. Countless critically ill patients accelerated their deaths, seeking salvation through it. For instance, while composing his final requiem, Mozart received bloodletting for headaches and neurasthenia. Within a week, he lost 2 liters of blood, over 1/3 of total volume. Modern medicine states blood loss exceeding 1/3 endangers life. Mozart became fatally weak and soon died. America's founding president, George Washington, also fell victim. For a cold-induced fever, doctors drained 4 liters over 2 days, hastening his death. Thus, as medicine advanced, people gained deeper understanding of human anatomy and pathogens. They learned to tailor treatments to specific diseases based on causes and conditions. Any one-size-fits-all treatment method is unscientific. The humoral theory and detoxification concepts were gradually abandoned by the medical community, and bloodletting faded from history. But even now, claims that bloodletting cures all diseases still resurface, pushed by those with ulterior motives. If you encounter this, be very careful. After bloodletting, let's discuss another detox therapy: enemas. This involves injecting water or medication into the intestines through the anus to flush out waste. This treatment first appeared in 5th century BC records by Greek scholar Herodotus, emerging slightly later than bloodletting. Their theoretical basis was similar. Both aimed to expel disease-causing toxins through artificial means. Unlike bloodletting, enemas expelled foul-smelling feces. Seeing this waste naturally made people feel how harmful it was to keep inside. 15th to 16th century Europe was enema therapy's golden age. Many believed constipation caused diseases and enemas were the perfect solution. In France, many underwent enemas 2 to 3 times daily. Records show the Duchess of Burgundy had servants administer enemas under her skirts while meeting the king. Opposite her, King Louis XIV didn't mind. He too was an enthusiast of this fashionable therapy. Reportedly, he received over 2,000 enemas in his lifetime. In the 17th century, Molière satirized in The Imaginary Invalid how doctors prescribed bloodletting and enemas for everything: edema, fever, tuberculosis, or chronic diseases. Though exaggerated, this reflected the monotony of treatments and persistent cure-all mentality. Unlike bloodletting, enemas were luckier. They still have medical uses today, but their scope is vastly reduced, now only for constipation or rectal drug delivery under strict medical supervision. Today, some still profit by promoting detox and intestinal cleansing under false pretenses. So, I'm reminding everyone, if you really want to do something to your intestines, please consult a doctor at a proper hospital. Next, let's discuss another still common modern treatment: surgery. Let's explore the absurd history of this treatment. Surgery is strictly limited therapy, typically for extreme medical conditions. Today, surgeries are performed by skilled doctors in sterile, pain-free environments. But in the past, sterility and pain management couldn't be guaranteed. This severely constrained surgical development. For a long time, surgery was often a lethal procedure. Take amputation, the most common surgery. Before the 19th century, effective anesthetics didn't exist. Operations were performed without pain relief, forcing doctors to work quickly to prevent patients from dying of pain or terror. In 17th to 18th centuries, typical amputations went like this. Patients were pinned or strapped to the table to prevent struggling. Doctors applied a tourniquet to the limb's main artery, then swiftly cut skin and muscle with a scalpel. Ideally, they slice cleanly, like cutting sausage, sawed through bone with a short saw, then cauterized wounds with red-hot irons or boiling oil. How fast were these surgeons? For instance, 18th century Scottish surgeon Benjamin Bell could amputate a leg in 6 seconds. French surgeon Dominique Leray was slower but more enduring.
Records show during the Napoleonic Wars, he performed 200 amputations in 24 hours, about one every 7 minutes.
More legendary than these speedsters was 19th century British surgeon Robert Liston. This guy wasn't just a skilled surgeon, he had showman flair. His operations were Broadway-caliber performances, often sold out.
Reportedly, Liston would shout to spectators before cutting, "Time me, gentlemen! Time me, gentlemen!"
And the audience actually timed him. His surgeries rarely exceeded 3 minutes. Once, moving too fast, he amputated a patient's leg, accidentally severed an assistant's finger, and slashed a spectator's coat. Such high-speed surgeries did reduce patients' suffering time, but forced doctors to operate crudely. Typically, severed bones protruded while jagged flesh hindered recovery and risked infection. Naturally, such surgeries rarely guaranteed life-saving results. In fact, mid-19th century amputation mortality exceeded 60%. Fortunately, anesthesia advancements now allow meticulous operations. Surgery transformed from slaughterhouse spectacles into clean, precise work with low mortality. Patients today owe gratitude to anesthesia and surgery pioneers. After these stories, do you think such absurdities only happened in ancient ignorance? That they wouldn't occur in our technologically advanced era? Of course not. Never underestimate humanity's bizarre ingenuity for health. In modern society, novel treatments still emerge endlessly. Electrotherapy exemplifies this, originating thus. In the 18th century, Italian doctor Aldini electrified a fresh corpse. Its jaw twitched, eye opened, hand rose, and legs moved. Thus, many believed electricity could manipulate bodies and cure paralysis. Reportedly in 1747, a French paralysis patient recovered after a month of electrotherapy. This isolated success lacked scientific credibility, yet it became electrotherapy's legendary case study. Like other therapies, electrotherapy was soon hailed as a panacea, spawning various devices. For example, in 1880, American Scott invented an electric comb, claiming to treat migraines and hair loss through electrotherapy. Actually, Scott's comb contained no electricity, just a magnetized iron rod generating static sparks during combing. But Scott was a marketing genius, riding the wave of electrotherapy while others hadn't caught on, making a fortune. In the 20th century, electrobath therapy, invented by Canadian doctor Trout, became popular. Patients sat in bathtubs with warm water electrified at low voltage.
Proponents believed electric currents stimulated the circulatory system, opened pores, and promoted detoxification.
Oh, how familiar that tune sounds! It was supposed to improve chronic diseases like rheumatism.
According to a British magazine report, former UK Prime Minister Margaret Thatcher frequently underwent electrotherapy, allegedly the reason for her radiant public appearance. EEN. If you ask whether it worked, the Prime Minister certainly wouldn't admit her 600-pound per session electrotherapy was useless.
Above, we've covered 4 historical treatments: bloodletting, enemas, rapid surgery, and electrotherapy.
By now, you've probably realized this book, The Bizarre History of Medicine, focuses on failed cases in medical history. And, from another perspective, without the bloodshed and skeletons of the past, modern medicine wouldn't have developed. For instance, while radiation couldn't prolong life, it paved the way for radiation therapy in cancer treatment. To prevent operating rooms from becoming slaughterhouses, medical scientists invented reliable anesthesia. While self-electrification in baths didn't detoxify, defibrillator shocks save lives in emergencies. While we rejoice in medical progress, we must still be wary of so-called miracle cures. All right, that concludes today's interpretation of The Bizarre History of Medicine. Reading notes are below the audio. See you next time.